Do I need blepharoplasty or brow lift? Let's find out. So I see lots of patients in the clinic for blepharoplasty, which is a procedure to remove skin out of the upper lid. Patients do complain over time, lid skin tends to accumulate and start to sag. So when I first evaluate patients for this procedure, the first thing I look at is the position of the brow. Frequently patients complain that they have more skin excess laterally toward the sides, which is a telltale sign that patients may need a brow lift. One way that I check this is that if patients have a lot of resting lines in their forehead, that means we know that the frontalis muscle, the muscle that raises the eyebrows, is constantly working to hold the brow in its position. I always have patients relax their brows completely with no muscle tone, and we can see the true position of the brow. I usually try to reposition the brow, and we try to go up and a little bit laterally with the brow, try to see the proper position. And a lot of times that will clear up some of this skin that's hanging in the lateral part of the eyelid. So we know that brows age down and toward the middle, which makes sense because gravity pulls it down, and then the frowning muscles always pull it toward the middle. So when we reposition the brow, we want to go a little up and a little lateral, so a little up and a little out. If you go straight up, then you can have the patient look surprised, which everyone is scared of with a brow lift. So we definitely don't want that. So the natural position is up and to the side. We frequently combine this procedure with blepharoplasty, but once you lift the brow, we usually have to take less skin in the upper lids. It's a pretty simple procedure. We actually do the whole procedure nowadays through one incision that we make up in the temple area, and we can release the whole brow and reposition it and tack it into place. And then we trim whatever excess skin is left in the lids. So great procedure, great bang for the buck. So if you want to test that you have this issue, just go in the mirror and lift your brows a little bit up and a little bit to the side, and you can see the nice improvement, and that'll show you whether you need a blepharoplasty or a brow lift or both. If you have any questions about this procedure or other procedures, please call and make an appointment for consultation.